Hello friends and welcome to your YouTube channel, My Expert Doctor. I am Dr. Shalini Singh Salunke with you as your consultant physician. In the previous video, we have mentioned that we started this channel with a vision. The vision was to equip one and all with knowledge about healthy mind and healthy body and move towards a better, healthy and happy future together with positive attitude and motivation. Now, to target our vision, currently, since COVID-19 is our biggest threat to the health of society, we are making informational videos on this topic. However, in coming future, we will provide valuable information in various aspects of obesity, diabetes, blood pressure, heart-related diseases, kidney problems, addiction, such public health concerns. We will also invite some experts from various fields of medicine who have immense knowledge and experience in health sector and who have made their name among us because of their contribution towards the society. So, we will ask your questions directly to these experts and you will get an expert answer for all your problems. I would also like to make an announcement. Considering current state of fear, anxiety due to COVID-19 lockdown, I understand that hospitals are not considered as safe place to get your minor ailments and other things cured. I also have noticed that people are avoiding their minor symptoms, their regular health checkup, which may bounce back. So, after considering the entire situation currently, I have decided to pay my part for serving the society. We are planning to start online free consultation to all my subscribers so that they can get their guide for health. Contact details and timing is being shared with you on screen currently. Share it with more and more people so that they'll take the advantage of this free online consultation service in need. In this COVID series, we have till date seen what are the precautionary steps we need to follow, what are the symptoms of COVID-19, what lab tests we need to do, how can we fight corona at home, being home quarantined. If you are liking all this information that we are giving through our videos, please hit the like button and encourage us. You can also share these valuable informations with your loved ones, your family members, friends, and anyone you know by any means of communication so that they will get benefited out of it. Also, do not forget to subscribe this channel and hit the bell icon next to it so that you will get the notifications of upcoming videos. For those who may not know, subscribing our channel is completely free. By doing this, neither you are paying anything or anyone, nor I am getting paid for the same. It's just an effortless way to make a bigger family, to bond with each other, to get help in the time of need. Now let's start today's discussion on vaccines for COVID-19. There are hundreds of questions hovering around all of us and we don't have appropriate answers to that. Now it's very difficult to answer every question in just one video. So we will be sharing all answers of every questions over next 2 to 3 videos. So today we are going to discuss these questions. In the end of the video, I will answer 2 important questions asked by Mr. Subhash Agrawal and Abhay Guruji. So please stay tuned till then. Now let's start with vaccines. What are vaccines? You must be having this confusion in your mind. What is the difference between vaccine and medicine? Now, answering it, vaccine is given before disease and medicines are given after disease. That means vaccines are there to prevent disease and medicines will cure your symptoms. As we are aware that prevention is better than cure. That means vaccines are better than drugs or medicines. So with this positive note, let's start and understand what vaccine actually is and how does it work. Vaccine is anything which stimulates your immune system to produce antibody without causing any harmful effects on your body. Understand this with the help of this diagram, and I'm very sorry, it's a horrible diagram, but this is how I can draw it. On your screens, whenever you are infected by a virus or bacteria, they enter your body. Your immune system identifies it as a foreign particle and start acting against it. But they do not have appropriate ammunitions and arms which can act against these viruses and bacteria. So they take some time to develop specific ammunitions. By that time, viruses multiply in your body and create disease or develop symptoms. You fall sick. After some time, your immune systems make specific ammunitions, kill your viruses or bacteria and make you disease free. But this takes some time. They also prepare some memory cells which are like prototype of your ammunitions, so that next time whenever the same bacteria or viruses are entering into your body, your immune system will not waste time, will wage a war against these organisms and will make you disease free immediately. Now the vaccines. Vaccines are just the part of a virus or bacteria. Either they are inactivated or weakened. They are pushed inside your body through injections. Your immune system identifies them as foreign particles and start making antibodies and killer cells specific for these viruses and bacteria. But since they are harmless, they are dead, they cannot multiply in your body and hence do not cause symptoms. So you are not falling sick, and yet you are getting your immune system worked up and antibodies formed against these viruses. Next time, whenever the real viruses will enter into your body, your immune system is already prepared with the help of memory cells and they will kill your viruses immediately. So this is the benefit of vaccines, that you develop your immune system without getting diseased. It's blessing in disguise. Now moving on to the next topic, types of vaccines. So we have 5 types of vaccines available to us. The first one is live attenuated. That means the viruses are made weak by either exposing them to ultraviolet rays or heat, whatever. The second is killed viruses. As their name suggests, they are killed. The third is protein part of the viruses. Some harmless part of the protein is taken and that is injected into your body. It's harmless because the virulent part is not there, the disease causing part. Fourth is your messenger RNA or RNA type of vaccines. As you know that humans have DNA, similarly viruses and bacteria have RNA as their genetic material, which is being taken and given a shot into your body. The fifth part is rather the most interesting one, which is viral vector type. Now these harmful viruses, some part of those viruses are taken and they are being injected or incorporated in some other viruses which are not known to cause any disease in humans. So let's move on to COVID-19 vaccines in world. So altogether there are 8 vaccines which are approved till date. If you are looking at your screen, you have Pfizer-BioNTech, which is a messenger RNA type vaccine, Moderna, again messenger RNA type, Johnson & Johnson, AstraZeneca, Sputnik 5, they are all viral vector type vaccines. Sinovac and Covaxin are inactivated virus type vaccines. Novavax is a protein-based vaccine. Now here, if you are looking at AstraZeneca viral vector type, the vector is chimpanzee virus, which is not known to cause any disease in humans, hence it is used as a vector. Now moving on to the next important topic, which is, are these vaccines safe? Now before answering that question, let's look into the data. The vaccines can cause some side effects. Let's categorize these side effects into 3 categories: urgent, rare to happen, and common side effects. The first we'll deal with urgent side effects. This happens within 1 hour of the vaccination. The most common form is anaphylaxis or severe hyperacute allergic reaction, in which you will experience some chest tightness, difficulty in breathing, swollen lips. You may also develop hives or rashes all over the body. Swelling of the body may also happen. It's a life-threatening situation, but your life can be saved with just 1 shot of epinephrine, which is easily available in any of the health centers. That is why you are advised to stay at the vaccination center for 1 hour after your vaccination. So, nothing to worry about. Now, the common side effects usually happen within 0 to 5 days of your vaccination. You may develop some low-grade fever, fatigue, body pain. Some also experience headache, nausea, vomiting. Mild cough can also be a symptom. You may also develop some local site, injection site pain, movement restrictions, swelling and redness in that area. These all are signs of your immunity. That means your immune system has started working against the vaccine. So it's good. These common side effects can easily be subsided by using paracetamol or any sort of antipyretic. Nothing to worry about. Yes, but if the symptoms persist beyond 5 to 6 days of vaccination, you must inform your vaccination center. Moving on to the rare category, these side effects are rather dangerous and rare. Now, looking at AstraZeneca and Covishield, there was news circulating, I think, in the past couple of months while we started using AstraZeneca in real population. There were news from Denmark, Norway, and other parts of Europe. They were saying that blood clots with low platelets are usually seen in young population who are being vaccinated with Covishield. After these data, European Medical Association and British Council started doing some research on this, and they came up with the data that this happens only 1 in 1 lakh population, whereas British Council mentioned that it happens 1 in 2.5 lakh population. Now, your risk of dying in a road traffic accident is about 1 in 500. And the same is with the heart attack, the risk is about 350 in 1 lakh. In current situation, dying with COVID infection is much more compared to this. So I think this data of 1 in 1 lakh, 1 into 2.5 lakh is very, very less compared to our risk of dying with infection. So vaccines are considerably safe. Now next, there are certain questions circulating in WhatsApp University. So let's answer those questions. The first one, are people dying in with COVID vaccine? Absolutely no. I just explained you that vaccines are either harmless or dead virus or the part of the viruses. They cannot multiply in your body. If you are not multiplying, they cannot produce disease in you. They can't kill you. So it's bullshit, no scientific data behind that. Second question is, people still getting infected after taking first dose of vaccine or second dose of vaccine? Yes, it might happen. Now, when you look into the data, the efficacy of vaccine to prevent the disease or infection is between 70 to 94%. That is, you still have risk of about 60 to 30% to acquire these infection. But good news is the efficacy of these vaccines to reduce mortality risk and risk of hospital admission, that means risk of acquiring severe infection, is 100%. You will not acquire serious COVID infection which will require admission or which will increase your mortality risk if you take vaccine. 100% safe. This is what data is saying till date. That means your vaccine is preventing you from dying. Good, right? Now, next question. Who should take these vaccines? In India, in the first phase, government vaccinated healthcare professionals and workers. In the second phase, everyone above 60 years of age, the elderlies, and those who are between 45 to 50 years of age yet have serious comorbid disease were projected. Now, if you belong to any of these 22 categories which I just mentioned on your screens and you have not taken the vaccine shot yet, it's a request, please go and take your vaccine. In the third phase, which is most probably getting started from 15th of May, everyone above 18 years of age is advised to take vaccine. Vaccinations will be available in government centers as well as in private institutes. Whichever you feel like, go and get yourself vaccinated. Now, what are the contraindications? Who cannot take these vaccines? So number one, anyone who is less than 18 years of age, pregnant women, lactating, breastfeeding women, those who have contracted COVID-19 disease recently or are having infections now, and those who have severe allergic disease or allergic reaction history against a vaccine. You are not advised to take the vaccines currently. There are certain vaccine-specific contraindications as well, like Covaxin has mentioned in its data sheet that those who are immunocompromised, those who are on blood thinners or receiving some medications like immune modulators, those who have bleeding disorders, or who have taken some other first dose of vaccine or are allergic to the first dose of vaccine are not supposed to take the Covaxins. For Covishield, it's just two. The first one, if you have taken some other vaccine as the first dose, and number two, if you have developed allergic response after the first dose. Now, moving on to the most important question, which one to choose, either Covishield or Covaxin? Now, we have just seen that the efficacy of both these vaccines are almost similar, ranging between 85 to 94% after the second dose. But reducing the risk of mortality and hospital admission is almost 100% in both the cases. Safety profile wise, almost the small side effects or minor side effects are almost same. Major side effects is only with the AstraZeneca, that too very rare. So we don't have to worry about this. Safety and efficacy wise, these vaccines are similar. Plus, you will not get an option of choosing one vaccine while registering for vaccination. So go ahead, whichever you are getting, take the first shot and be safe and secure. Now, I would like to answer the question asked by Mr. Subhash Agrawal and Abhay Guruji. In the next video about vaccinations, also make some clear points, especially regarding people who have tested positive before the first dose and people who have tested between the two doses. There is confusion when they should take their jabs. Some count day from the day they tested positive, some count days from the day quarantine period ended. When is the jab most effective? Now, to answer this question, first of all, if you are getting I'm giving an example. Suppose you are vaccinated on 1st of May and the vaccination center asked you to return back on 15th of June, which is 45 days after the first shot. Unfortunately, you contracted disease on 10th of May. So you will be asked to stay in quarantine till 25th of May, that is 15 days from the day of tested positive. After 25th of May, you will count 15 more days, that is 2 weeks, from the day your quarantine ended. You have to count 15 more days, which is coming somewhere around 9th or 10th June. So you can take your second shot after 9 or 10th June. Now, since your scheduled date is 15th, you will go and take vaccine as per the schedule. That is, whichever comes later, 15 days after the home quarantine ended or your date of schedule, whichever comes later. You have to go at that date or time and get your second shot of vaccination. So I hope this would have answered your question. If you still have some doubt, you can feel free to put it in comment box. For others as well, in this entire episode of vaccination, if you have any question, you can put it in the comment box. I will answer it in the next video or the third video of vaccination. This was all about this one. Now in the next video, we are going to discuss how to register for vaccination, what to do after your registration till the date of vaccination, what to do after vaccination, what precautions you have to follow. Plus, we will also discuss about some special health conditions like diabetes, blood pressure, pregnancy, patients who are on blood thinners, what precautions all these category people need to take before going for vaccination. Till then, stay safe and happy at your places.